How do liquid biopsies work for pancreatic cancer? Have you ever wondered how doctors can detect pancreatic cancer without invasive procedures? Liquid biopsies offer a fascinating solution. They work by identifying cancer-related materials found in body fluids, mainly blood. This method allows for monitoring the disease in a way that is much less invasive than traditional biopsies, which often requiring surgical tissue removal. The process starts with a simple blood draw or collection of another bodily fluid. Once the sample is obtained, it is tested for various substances that are shed by pancreatic cancer cells into the bloodstream. One of the key components analyzed is circulating tumor DNA. This is made up of small fragments of DNA released by dying cancer cells. These fragments carry genetic mutations that are specific to pancreatic cancer. By detecting and analyzing this DNA, doctors can reveal not only the presence of cancer but also its genetic characteristics and any changes over time. Another important aspect of liquid biopsies is the detection of circulating tumor cells. These are whole cancer cells that have broken away from the primary tumor and are now circulating in the blood. Identifying these cells can provide valuable information about the tumor's burden and how aggressive it might be. Additionally, liquid biopsies can analyze exosomes. These are tiny vesicles released by both healthy and cancerous cells. They contain proteins, RNA, and DNA that reflected the biology of the tumor. By examining the molecular cargo within exosomes, doctors can detect pancreatic cancer with high accuracy. Liquid biopsies have several clinical applications that are particularly relevant for pancreatic cancer. They can aid in early detection, identifying the disease at stages when traditional imaging methods may not yet show tumors. This is crucial since pancreatic cancer is often diagnosed late, leading to poorer outcomes. Moreover, liquid biopsies can support diagnosis by providing molecular insights that complement traditional biopsy methods. This is especially helpful when obtaining tissue samples is difficult or poses risks to the patient. Another significant benefit is their role in treatment guidance. By revealing specific genetic mutations and characteristics of the tumor, liquid biopsies help tailor personalized therapies for patients. Lastly, these tests allow for ongoing disease monitoring. By conducting repeated liquid biopsies, healthcare providers can track tumor progression, assess response to treatment, and detect any recurrence without the need for invasive procedures. While the technology behind liquid biopsies is promising and continues to be studied, it is important to note that it is still largely investigational for pancreatic cancer. It is not yet a replacement for standard diagnostic and monitoring procedures. Current research indicates that combining liquid biopsy markers with traditional biomarkers, such as Ca-19-9, can enhance accuracy. However, challenges remain, particularly regarding sensitivity in very early disease stages and the need for standardized clinical protocols. In summary, liquid biopsies representing a groundbreaking approach to analyzing cancer-derived materials in the blood. They offer a less invasive, dynamic method for detecting and monitoring pancreatic cancer. This innovative technique has the potential to improve early diagnosis, personalize treatment, and track disease progression, all of which are essential for enhancing pancreas health and pancreatic cancer care. However, it is crucial to remember that these tests are intended to complement established diagnostic methods and requiring further validation before widespread clinical use. Always consult healthcare professionals for personalized medical advice.